My name is Dr. Lisa Fox, and I am a pediatric dentist, and I practice in the Metro Denver area, South Metro Denver area. We actually have one practice with two offices. In the past, we have used a pseudo digital database. We had to log in remotely to get to that database. Very difficult. It took a lot of late night trips to the office for last minute kind of things. Stayed at the office incredibly late writing all the notes. Pediatric dentists see lots and lots of patients. I saw 60 to 80 patients a day. Writing those notes and getting everything tied up the way it needs to be was difficult. Being able to access everything I want from home has allowed my office manager to be able to be home a little more and work from home some, and my husband who helps her out to be able to do some of the work at home as well.
My name is Dawn Gillespie. I work with Colorado Kids Pediatric Dentistry. I'm the practice manager. I have been in the dental field for about 25 years now, and with Colorado Kids for 15 of those years. I think the best thing for me with Curve Dental is as a practice manager, I think any practice manager puts in a lot of hours. So with Curve, you're able to go home and complete a lot of stuff that normally you would be at the office till 6:30 or 7 trying to complete. So now I can go home, be with my husband, and still be able to log in, manage a lot of the Curve Dental, manage a lot of the practice. I can pull the reports, I can check how things look for that day, and still spend time with my family.
One of the biggest differences is the imaging. We always had a separate imaging program than the other database, the business side of it, and it was a bridge and not always as predictable as we wanted it to be.
When we were in our software that was actually server-based software, it kind of became a nightmare for me because so much of my time was taken up with IT issues. With a remote connection, not an easy thing to do, especially with digital imaging. So when we went to the cloud, it freed up an enormous amount of time for me to focus on other things that is actually patient-related instead of IT-related.
We're not piecemealing things together. It's all in one program. My favorite thing about Curve Dental, the company.
The customer service is phenomenal.
The people, of course.
As the practice manager, I've done a lot of tickets, but I've also made a lot of calls. If we can't seem to figure out some of the reports, they've actually logged on, they've helped me create all of the reports, and they've customized them to our practice and our needs.
They want to make this program work for everyone.
I've tried to do a lot of them on my own, but the nice thing is, they don't just do them for you, they teach you how to do them so that later on you're able to do those independently and don't have to rely on them quite as heavily.
Some of the first questions that some of the trainers and programmers are asking us, tell us how you work. And they listen. Pediatric dentists are very interested in being able to see the huge volume that we see without, doing dentistry to the paper. And we don't want to do dentistry to the paper. We want to do dentistry to the kids and forget about the rest. So I preface discussions with my friends who are looking for software by saying we've used a few softwares, and we were not excited about having to convert a database. And it was a great decision that we made to find out as much information as we could, and when we did, this Curve was the answer for us.